This segment is sponsored by Virginia Physicians for Women.
Doctor Will See You Now. It's a practice where you'll always see a physician, and these specialists cover all aspects of women's medicine. Doctors Allison Giles and Monica Washington of Virginia Physicians for Women are here with us this morning. Ladies, it's great to see you.
Thank you for having us. Good morning.
Very good to be here.
It's a pleasure having you, and this is a really important fact that we don't want to overlook. When you make an appointment, a doctor will see you. There's a great team there, but that's important. Why?
Well, at Virginia Physicians for Women, we feel that when you make an appointment, you are investing in your own health, and we would like to return that investment by giving you our best, which is our physicians. We're very proud of the staff that we work with, and we are happy to give you the very best of the best, which include all of our physicians.
And you have an amazing support staff supporting those physicians too, because you then can communicate with nurses and staff and everybody there, but the physicians will see you, and they're seeing women in this community, you're seeing women in this community for a lot of different reasons. One of the big concerns that seems to be high on the list right now is Zika. Monica, why is that?
Yes, the Zika virus is a very huge thing that people are talking about right now. Basically, mid last year, 2015, it became prevalent again, and the issue is that the Zika virus is spread by mosquitoes, and it's not only here in the United States, but in many of the Caribbean islands, also in South America. There's parts of Southeast Asia, so places where women in the United States travel to. The concern is that the Zika virus can be passed down through mother to fetus. In addition, it can be passed through sexual contact. The issue is that it can cause pregnancy loss, it can cause babies to have what's called microcephaly, there can be growth restriction, so we want to try and prevent women from contacting that virus during the time that they're either trying to conceive or during the time that they're pregnant.
So women who are in the practice have a lot of questions around that time, if they are trying to conceive or if they are pregnant, newly pregnant,
right.
And they want to work with a doctor, want to work with a team where they can ask questions and learn.
Definitely, definitely. If a woman's trying to conceive, we actually recommend that she not travel to a country that Zika is prevalent in for 8 weeks. And then after 8 weeks, if she does have to travel to that country, she needs to try to refrain from getting pregnant and practice safe sex or abstinence. For men, they actually, if they've traveled to a country where there is Zika virus and they can have possible exposure, they actually need to wait 6 months before they should try to conceive.
So that's the top of our list of topics that we were going to cover today, and a super lot of information on that. But that's what your patients really want to work with when they come in and work with you. Annual exams bring patients in, women in to see you throughout the year. Allison, a lot of screenings go hand in hand with that too.
Absolutely. We consider the annual exam to be one of the most important points of contact we have with our patients. It gives us a chance to touch base on all aspects of their health, but most specifically screening for important cancer risks, for instance, cervical cancer, breast cancer, and identifying any other risk factors that may point them towards other specialist needs. Our cervical cancer screening guidelines change quite often, and it's not a cut and dry procedure where we go exactly by the guidelines every time. Instead, it's a team decision between doctor and patient and a discussion about the appropriate way to screen each patient. Do you need a pap smear every year? Do you need a pap smear every 5 years? Again, those are things that your doctor at Virginia Physicians for Women can discuss and decide with you. As far as breast cancer screening, it's our job every year to make sure that we are doing an appropriate full physical exam that will include a breast exam. And should we find anything of concern on that exam, we have a vast network that we can refer to as far as getting that abnormality worked up. But as far as the yearly mammogram starting at age 40, we offer mammograms within our own practice. We can do that there. And we also have 3D mammogram technology as well that we can offer.
Comprehensive care and a team approach. Ladies, we're out of time, but doctors, thank you for talking with us this morning.
Thank you so much for having us.
Appreciate having you. There are 6 area locations for Virginia Physicians for Women all around our area in Richmond and Prince George. You can call 897-2100. Just call that one number and they'll get you in touch with the location most convenient for you. You can visit online, vpfw.com.